Okay, I think we may begin. So I have clicked recording,
Excellent.
and we've got I hope everyone can see the screen. Collective action with communities. Just give me a thumbs up if you can. Awesome, cool. Okay, just gotta find my arrows. Carol, can I invite you to open our Wānanga
Karakia,
this morning,
certainly.
please?
Kia ora koutou katoa. Ko Carol Coin toko ingoa. No mai, haere mai, and welcome to our fourth Wānanga. I will open us up with a karakia. He karakia timatanga. Tu taua mai I runga, tu taua mai I raro, tu taua mai I raho, I waho, tu taua mai I roto, ia tau ai, te mauri tū, te mauri ora, I te katoa, haumie, huie, taeki e. Amini.
Kia ora, Carol. Thank you so much. I'm just going to flick through the slides. I'm just organising my screens. Tēnā koutou katoa and sat sri akal. Ko inia te whakapaparangi mai, ko East London te whenua tapu, ko te awa kairangi te kainga, ko Dao ko Gil tōku mama, ko Chan Singarual tōku papa, ko Chenti Jan Ekim, ko Toku tamariki, ko Jaj Gurwal tōku inua. Nō reira, tēnā koutou katoa. So good morning and welcome everyone. I've just put up there if everyone is able to just introduce yourselves, your name, your role in your organisation and chat function so we can keep a track of who's on and also for you guys to connect with each other. So welcome to this session. I'll just start with a little bit of introduction about myself. Who am I? So my name is Jaz Gurwal and I am the Program Director for Collective Action with Communities with Collaborative Aotearoa. I hail from inner city East London, England, where I was born and raised with my 5 older siblings by my parents, who were there on your screen, who migrated from Punjab, India in the late 50s to India. And I obviously was compelled to follow this tradition and migrated to Aotearoa, New Zealand 20 years ago and have made this whenua home for me and my 3 children. I have many years of health and social sector experience, not just spanning continents, but also spanning frontline, operational, strategic, and commissioning roles. And much of this mahi has really been rooted in my psychology and my mental health, social work training. So therefore, I just want to acknowledge the lens and the bias that I bring. So for those who are not familiar with the work of Collaborative Aotearoa, I thought I'll just quickly put this up. This just as a reminder for those that are familiar with us that we're a national learning organisation. We're a small and mighty team, and we support a network of primary health and community groups across the Motu who act as a backbone and support for their frontline services. We've got 3 programs of work: Healthcare Home, Digital Health, and Collective Action. And it is the Collective Action with Communities program of work that is the topic of our Wānanga today, and especially its ability to support localities and place-based care. So I'm just going to do a quick recap. This is the 4th of this Wānanga series, and they're all been focused on helping to systemize general practices in their approach to addressing the health and wellbeing outcomes of the people that you're in service to. So we kicked off with a focus around managing urgent and unplanned care, and that was about ensuring that patients who are ill or concerned about their health issue get the right care and the right advice from the right person at the right time. So we had a lot of, the first Wānanga was focused on clinical triage. Then we talked about the proactive and routine, focus on proactive and routine preventative care. And that was thinking about the skill set of the general practice team and enabling people to work at the top of the scope with a greater focus on prevention to reduce burden on healthcare and improve population health. Then we had a focus on data and digital innovations and how they can enable and streamline the processes to improve access to care and enhance patient outcomes. So now today's Wānanga is really shifting the focus to think about fostering the integration and the greater connected models of care and services that you deliver so that people have greater choice over the services they access. This is a key service element in the healthcare home model of care interdisciplinary team approach. And I'd say that general practice is a key partner in the community and is well placed to help drive change so that the burden and responsibility that you guys are experiencing, the sheer magnitude of the mahi that is kind of being placed on general practice to achieve her order is really shared. No one agency can do this work alone. And so this Wānanga is really about kind of thinking who else and how else can you connect with others. So the question I'm hoping to answer for you today is really how can you, within your health and wellbeing networks in your community, place yourselves in the driving seat to help design and implement localized initiatives that really work for your community. So what is our kaupapa today? I'm going to give you a really brief overview of an approach that we know will help you in your communities and networks. The approach is called Collective Action with Communities. It's a really simple and comprehensive approach. It's not new. It's not a new concept, but it offers a rigor that's relevant to New Zealand and New Zealanders and provides a common language which makes it easy for people to take it on and apply it. For many, it involves a different way of thinking, a different way of being, and a different way of working and taking action. It essentially involves 6 conditions of success, and on the visual you'll have on your screen in front of you, you'll see on the outside there's key aspects of it, and they relate to leadership, culture, and iwi partnerships. And that's that group kind of forming and creating what matters to whānau, and then progressing to collating a rohi, a locality plan. And this of course will be underpinned by metrics that matter and building trust with continuous engagement. And then of course all of this mahi is facilitated by a dedicated backbone support. Given the time constraints, I don't have time to go through each ingredient for success. Instead, I'm just going to focus on sharing some tips and tricks for you on some of the preconditions that we talk about. And that's really about how to embrace new ways of working, what I refer to as the small actions that you can take now to achieve big change. And then we'll hear from Renee, who will share with us the work that she's done about her why, her how, and her learnings from actioning one of the key conditions, which is what matters to whānau, what matters to communities. So just to, sorry, I meant to click onto this slide that shows the key ingredients of success. So just to emphasize and reinforce that Te Tiriti and equity are at the core of this mahi, and I'm sure you'll all be familiar with this. So change. Change is an inherent part of our lives, and it is through change that we make progress. Our health system seems to be in a constant state of change, massive change, in fact. And I just want to remind us all that, change doesn't happen on its own. It needs a catalyst, and what better catalyst that we've had in health than a global pandemic and currently the new national health system reform. So just picking up that point around the current landscape that we're working in, I have got new hopes for healthcare. I'm an optimist, and so I'm quite excited by the opportunities that are presenting themselves with the reorganisation of our health and wellbeing services into localities, and really thinking about localities essentially bringing about services, including general practice, together into more responsive place-based networks. But how do we do this? So within this landscape, the space that we're all working in, we're all faced with choices. We can either stick to our usual ways of doing things, or we can look at new ways. So how can we ready ourselves? So New ways might involve thinking about different ways. And one of the things that collective action asks people to think about is asking people to reframe the nature of the problem. So this is about encouraging a shift in your perspective so you can view the problem through a different lens, new lens that can then help you to foster innovative solutions and fresh approaches. A good example of this is in one of the general practice that I connected with. They reframed DNAs from did not attend to did not attract. And just merely doing that, what they did is they began to uh, address the nature of the problem became quite different, and their solutions were more focused about making the appointments that they were setting up more attractive and more accessible for people. So this is quite critical in terms of really kind of thinking about different ways. The second point is around asking yourself about refocusing your work with others. So, this places an emphasis on the importance of redirecting your efforts to shared goals and aligning and sharing your resources, whether this is money or skill sets or assets, so that you can maximize your collective impact. A good example of this is the use of the other resources that might be available in your community. And some of you may have heard in one of the previous Wānanga, Carol has shared a story about the work that her practice did with Pehiaweri Marae, where to engage with their unengaged populations of rangatahi who weren't coming for their COVID vaccinations. They reached out to them and they partnered, and they were able to use the marae space for doing these COVID vaccinations. So that's an example of actually thinking about the resources that are available in your community to achieve the outcomes that you are wanting to progress. And then finally, I just want to reiterate that collective action really does ask you to think about the different perspectives and thinking about the different voices that you have at the table. So reimagining who is involved is about promoting inclusive and diverse participation. It's encouraging the involvement of different stakeholders and partners to foster collaboration in new ways and bring those varied perspectives. So this is really about reaching out and connect with people in your community, your maraes, your churches, your schools, your kohanga, places where people that you are serving congregate. So critical to this is the voice of those who are most impacted and affected by the change, our whānau. And we're going to return to this point later. So, of course, it's important to recognise that there will be resistance to any change, and some of you may well be feeling this. And we need to make sure we kind of highlight and there will be a need to address these emotions. And I just wanted to share this whakaaro that Jen Margaret, who is a treaty ally, she documents in a lot of her literature, and she talks about meeting resistance. So when we're faced with denial, meeting that with insight. When you're met with guilt, meeting that with action. When you're met with shame, meeting that with recognition. Where there's fear, create vision. Where people say, this doesn't work for me, this doesn't apply to me, or this is irrelevant to me, I'd say they need to get with the program because a lot of this mahi is going to impact all of us. And another reason that often people will kind of share in terms of their resistance is people will say they have no time for this, that this is, and I know that this was a subject of our previous Wānanga where Mel and Carol shared some opportunities for efficiencies within general practice, and a lot of it was drawing on lean approaches. So I recommend that you revisit those, because I think it's important to think about some of those approaches to create space and create time that actually can give you the time and space to do this mahi. Okay, so collective action with communities calls for transformational change in how we approach and adapt to the issues and complexities that face our health and wellbeing sector. And general practice is well aware of these issues and challenges. These can be on an individual level, on a personal level. These can be in a group, of individuals, so maybe across your general practice team, or these could even be on a community, a locality, or rohi level. So I'm going to share with you some of the tips and tricks for navigating this. So to start with, be curious and courageous. Be radically open to new and fresh ideas and perspectives. Make sure that these are not tinted by people's job titles, expertise, or knowing. And so where people come with titles and management in their title, often don't let that tint your curiosity and your courageousness to ask and invite solutions. Curiosity asks us to accept that we can't know everything. So question and listen intently, see and hear it all, and be courageous and be changed. Another tip is learn through doing. Choose to learn through taking action and using the lessons to improve your ideas. The Lean Sigma tools that Mel has mentioned previously, one of the things that Mel often says is start and get better. Just begin. And there's lots of other tools like the ProSci ADCAR change management model, and there's model for improvement, which is based around PDSA cycles. So there's lots of theories around. But what I'd encourage you to do is go ahead, test your ideas with a willingness to change and adapt. And so just get better each time. Use the results to inform your decisions and allow space for honest reflection before you begin again. So making sure that there is time to reevaluate and then start again. Cherish the growth and learning opportunities that come from failing. And so failing is quite critical. And I'd say that it's really critical that we embrace failure and find comfort in it. And so really detaching yourselves and like I said before, reflect often. Just keep asking yourself, are we on the right track? Whether you're doing an initiative that's working with whānau, is checking and are we on the right track? Are we hitting the mark? This idea that the solution of eureka moments, I don't believe that exists. I think there's often those eureka moments that people refer to come from many tries and failures. But within that, what we want to try and do is aim for small, not epic failures. So it's okay. And so if we can ensure that we create a culture that supports others to fail, I think we will all learn and grow from that. Another tip that I will share with you all is that it's okay to be in the grey. Be comfortable with being ambiguity. You don't have to know all the answers. No one person has all the answers. And so dive freely into the grey space of exploring and testing and learning. And encourage everyone to ask questions and keep asking questions. And so you continue this exploration of new possibilities and new opportunities. And really step out of your own comfort zone and invite creative and innovative thinkers to widen your view and think differently. And this is really what I would say is reaching out to others in your across your networks, others in your communities, other providers who will be sharing some of the same challenges as you, but they'll be bringing different perspectives and different ways and different ideas and solutions. And people themselves are really key to this. People that you are in service to. So elevating the voice of people with lived experience, valuing their participation, creating a space and a safe and open space for whānau and people to express their views and aspirations. This is a key aspect of the collective action approach, elevating the voice of people who have been impacted. But before you can kind of explore this, and we will hear from Renee shortly, we do need to unpick and recognise our own biases and loosen our grip on the processes and solutions that we have all been conditioned and have been living and breathing. So I'd really encourage people to kind of do some deep diving and really understand your why. Allow descriptions of issues and priorities to flow from the experiences of the people, of the whānau that have been impacting, enabling them to play an active role in making the decisions that impact and shape their lives is really critical and is a real important aspect of taking a collective action approach, empowering them to generate and co-create and co-design the ideas and the solutions is really critical. So it's a real pleasure for me to introduce Renee Bailey from Whanganui Regional Health Network, who will now share her experience of the how, what and why her and her team went about capturing the voice of their whānau, their community, to inform their collective action with community. So, Renee? Can you hear me, Renee?
Renee, you're on mute.
Okay. Kia ora koutou katoa, i ngā reo, i ngā karanga maha tēnā koutou. Ko Renee tōku ingoa, ko te Whanganui Regional Health Network taku mahi, hoi anō, hei te kairuruku e pai ora ahau. I tēnei wā, kei te whakaruru hau me te kōrerotia collection actions, i nānei e te mehuri noa kei te whakapākiatia ko Aotearoa, ko te awa ko au, ko Renee Bailey tōku ingoa. Kia ora everyone, my name is Renee and I am the Paiora Coordinator for the Whanganui Regional Health Network. And a few of the talking points that I want to discuss today is the importance of the whānau voice. What was the processes that we implemented to engage with whānau? And lastly, what was one of my top 2 learning discoveries and where to from here with collective actions? So, the importance of whānau voice. We all have a good understanding of the Paiora Bill, but if you're unfamiliar with it, I would recommend this booklet here and just going through it. It's a really easy read and I always revert back to it all the time. On reflection to that, I also look back on the 6 pos. For me, I call it the 6 pos, some call it the pillars. And this is where I measure where I'm at or what I want to achieve. And yet it was the ingredients to achieve the Paiora equity lens. Now, looking at the community perspective, we all try to lean in and be a part of the grassroots approach and engaging with the voices of the whānau. And now that is the most critical part of the co-design process around health. To be fair, it's not all about getting or collecting stats. It's about gathering those narratives from whānau about what they want from their GP providers. That's where our equity lens aligned beautifully with the whānau voice and how we can encourage the co-creative and co-design with your whānau. From there, I also had the code of expectations for our health entities with consumers and whānau. Now, this was really important, especially if you're having the kanohi, te kanohi approach with your whānau. And sometimes not everyone understands where I'm coming from, so it's really good to go through it with them and get the expectations and also a safeguard for both the whānau voice and yourself, which sometimes I go out to be the whānau activator. Now, some of the processes upon reflection of doing our co-design with whānau in mind, I had to just look back and reflect on where I've been before I started this role. So I was born and raised in Whanganui on the awa, but I left 19 years ago to travel. So I returned home and that's where I received this new role as the Paiora Coordinator. This meant I actually needed to get to know and activate networks around the Whanganui region, which I didn't have really much to work on because I haven't been around. So things have really changed in that rohe. So I was really fortunate to have some really great networks in the Wānganui Regional Network, which was Anne Koweka, Araraina Davis, Janine Ryder, Joe Mayer, Gums Putty, and also Jude as well. So they were all my connectors, and they invited me along to connect with other NGOs, other whānau, so I can get really familiar, and then they could start trusting who I am, so I can start going through the whānau voice, whānau engagement. So how did we get to this point to engage with whānau? So let's just go back a bit again. In the Wānganui region, we have up to 12 GP providers. The aim was to focus on 3 of those GP subsidiaries that we manage under the network, and that's the Wānganui Regional Health Network. The purpose was to start engaging with those whānau in those regions. Some of my engagement methods would be a mixture of paper-based, kanohi ki te kanohi, recordings, and QR codes. Some of the questions that was entailed was what actually matters to whānau. We kept it really simple. So what actually matters to whānau? When you visit your GP practice. What matters to whānau? When you are unwell. What matters to whānau? To help me stay well. We actioned the following surveys or whānau engagement to 1, an urgent and unplanned care clinic with a mixture of both QR code posters located in the waiting room and clinical areas. This outcome, we collected up to 33 to 34 responses with a strong theme flowing through it, and that was only in a 21-day period. The second one was routine and preventative care clinics. The first was a rural base. They were able to have a solid partnership with an iwi health organisation, so those navigators were able to action that in their own whānau engagement, in their own rohe. The other health provider, which was in an area of progressive developing areas of Wānganui, and that's where I was able to engage with those NGOs and have those whānau engagements, and I was actually quite privileged to get invited to one of the campsites where emergency housing communities were starting to grow, and unorganised groups that were predominantly Māori had a lot to say about the survival and the everyday welfare and health, which was such an honour to be part of. But that was because they started to trust who I was, and I started to be visible. Once again, I used the same questions across all whānau engagement. So whānau, the whānau voice is growing in the narratives, themes, and their own aspirations, which I find really quite inspiring for us to start measuring it up to our clinics and start speaking and presenting those themes to our whānau once we get the whānau voice on record. So where to from here? So reporting back to those whānau and organisations and finding those engagement pieces and opportunities is, I think, is one of the most important factors, and building those relationships by being visible and fulfilling, creating that trust factor is really important. That's where I find myself, that is my why now. We're testing ideas, and re-evaluating and reflection is another thing that I like to go back on, especially with my 6 POs. Whānau from all domains have the opportunity to engage now, and they can actually point out what they want in their health expectations. So those are all my reflections that I can think of at the moment in its simplest form by achieving the pilot outcomes. And so I'd like to thank everyone today. Ngā mihi nui kia koutou katoa.
Thank you so much, Renee. That's awesome. It's great to kind of have you share your experience, and a couple of bullet points that I will just reiterate that you've highlighted is within this kind of sharing some tips and tricks. You said find your connectors. That's really critical. Often people are saying, you know, how do I reach out? I think Lovey had raised, you know, how do you know? Is really look at people within your teams, within your PHOs, people kaimahi that come into your practice as well. It's just really reach out and find them. Think about your methods carefully. Give some thought whether face-to-face or online is best for you. And go to the places where people are. As Renee said, you went out to the campsite. That's amazing because you reached out to a population that probably you would not have reached out if you just waited in a general practice for people to come to you. Being visible is so critical. That's really valuable because how else will you build trust? And so, Renee, thank you so much for sharing that. Because if you're not visible, then how do people know your face and know that, and you know, connect and see you as a trusted source? So, in summary, I'm just kind of coming to the end of our time. And this was really a short and punchy presentation on some tips and tricks to help you within your health and wellbeing networks, and as you journey to design and implement your own change initiatives that are relevant for the people that you serve, and really to address and improve the haora of not just your teams and your community, but I'd say also your own haora, so you feel empowered and so you feel enabled. Collaborative Aotearoa is here to help. So I've just put up on the screen there our website. We've got some amazing resources and some tools. We are also delivering and facilitating a number of workshops around the country, around storytelling, around how to engage with your communities more effectively. Renee's referred to our online, the online modules. The booklet that Renee shared is a really good resource to back up the online module that is around, which will give you a really good awareness and understanding of collective action. I'm available to come and do some overview workshops as well. We're happy to meet you where you are at. So please reach out or go onto our website for further information. So I'll just share this. The future really does depend on what you do today. So thank you so much. There is my email address, and if you'd like to be put in touch with Renee as well, if you want to take an offline chat, thank you so much, Renee, for sharing your experience. I can put you in touch with her as well. So I'm amazed that we have gone through this and we still have a few minutes to spare. So I'm just going to stop sharing before we go through our closing karakia. I'm just checking with Carol. Have there been any questions, or does anyone want to add anything? I see Amajit, have you got your hand up?
It was really just to say, were there any questions that people wanted to, you know, if they didn't want to put them in the chat, to just, you know, also raise their hand to get a bit of dialogue, you know, thoughts, reflections, challenges that you're facing right now, because obviously we're aware that general practice in particular and community organisations are facing a lot of winter pressures and demand, and sometimes the change that is coming our way is like a bullet train that, you know, we're just trying to ease that for the sector, because it's coming no matter what, but we do want to recognise the actual demands on your mahi. So yes, it's anything that people did want to share, and as Jazz said, you know, that ability to follow up with us, and I loved both the overviews in Renee, you know, talking about our collective action approach is the 6 pose. I love it. I think it's really, really good. And that little booklet is meant to be used as that guide. So it's great to see it in action. So yeah, ngā mihi nui.
So if there's no questions, I'd ask you, Carol, to... Oh, you have got a question, Carol. You're on mute, Carol.
Yeah, I just have a question for Renee. That was awesome, Renee, and it's just so exciting to hear what the mahi is that you're doing and how it's and you're putting it into action. One of the things I would like to ask you is, are you at the stage of actually implementing that into the practices? Are you, do you know, like you've listened to the whānau voice, you've gathered the information, and are you at the stage of implementing those findings into general practice?
Can everyone hear me? Okay. At the moment, we're in presentation stages, so I have been touching base with Jazz to find out where to from here. I've got the collection of data and all the narratives and everything on those lines, and now it's just presenting back to those GP providers and seeing where we can start aligning ourselves up with the HCH model.
Thank you.
Is there any other questions, queries, worries or woes in regards to my kōrero today? Ka pai. Look, reach out to me. I'll pop my email on the messenger. If anyone wants to contact myself or Jasmine, nau mai haere mai.
Thank you, Renee. Okay, so Carol, I'll just invite you to close with our karakia. Thank you so much, everyone, for joining us today. Go well. Enjoy the long weekend.
Excellent. Thank you. Thank you, Jazz. Thank you for that wonderful presentation. And yes, enjoy your weekend. Yes, long weekend, yay. Okay. He karakia whakamutanga. Ko rangi nui e tūnei. Ko papa tuanuku e tā koutou nei. Ki tau te rangi māria. Ki runga i tau tātou mahi tahi. Haumie hui tā e ki e. Kia ora koutou.
Ka kite.
Ka kite.
Ka kite.